Let's talk about iron deficiency. Now, iron is very important in the body because it forms red blood cells. In case you have a deficiency in iron, there is so many things that can go wrong because you see, red blood cells usually take the oxygen from the lungs to the body, to the other organs of the body, and then brings back carbon dioxide to the lungs, and then that is wasted, it's taken out of your body. So it plays a very important role. It means that you cannot live without those red blood cells. They play a very important role. Now, in case you have a deficiency, there are several things that you're going to see, and you're going to see into them and how we can fix that in this video. Now, iron is an essential mineral required for various vital functions within the body. And when the body lacks sufficient iron, it can lead to a condition that we call iron deficiency anemia. Now, this deficiency can manifest in various ways, and we're going to look at some of them. The first one being anemia. Now, you see, anemia is when you have less of the HB, hemoglobin. You have less of red blood cells. So the capacity of carrying oxygen is reduced from the body. And this usually occurs when there is a reduced number of red blood cells in the body or a decreased amount of hemoglobin, which impairs the blood ability to carry oxygen to the tissues. The same hemoglobin is used to carry CO2, this is carbon dioxide, from the organs and outside the body through the lungs. This can result in something like fatigue. We have weaknesses, shortness of breath. Fatigue is because you're not getting enough of that oxygen. Weakness will be you are not still getting enough energy. Oxygen will be used in mitochondria to break down the sugar that you have to provide energy for the functioning of the body, everything. Now, the shortness of breath will be the body is trying to compensate for the little oxygen it's getting. It's trying to make you breathe more so that you get more oxygen to compensate for the lack of the hemoglobin that you are talking about here. So that's why you're going to have fatigue, you are going to have weaknesses in the body, general weakness, and then you're going to have shortness of breath. And the symptoms will come from minimal physical exertion. You're almost doing nothing, but then you're getting the symptoms. You're getting fatigued, you have weaknesses, you have shortness of breath, and you've not done anything. Now, iron deficiencies has been associated with cognitive impairments, particularly when it comes to children and adolescents. It can lead to difficulties when it comes to concentration, when it comes to memory, and even learning. And it can affect their academic and cognitive development. Iron deficiency can lead to retardation and delayed development when it comes to children. You know, when they are growing, they require a lot of oxygen, which will be required to break down sugars, which is also still in high demand because of development which is taking place. So a lot of oxygen is required. So when you limit the amount of oxygen, you're also going to limit the amount of energy they are going to require. So it's also going to be limited, meaning that they are not going to grow as fast as it's required. So even development will also be limited. Also, when it comes to pregnancy, we have several things that can happen here. You see, you can get preterm babies, also low birth weights, and also developmental issues when it comes to a baby. And that's why it's very important when you become pregnant. It's usually very important for you to always go to a hospital, get assessed for your HB, so that in case you have a lower HB, they can give you medications that will help, or some of the supplements that will help in boosting your blood, because this is the time when the demand is very high. The demand for oxygen is very high. So if you don't have enough iron, you're not going to make enough HB, which will be required throughout this process. Iron deficiency can also lead to brittle hair, hair loss. You can get pale and dry skin, and also it can lead to brittle nails. Now, this is something that we call restless leg syndrome, and this usually happens to some individuals with this deficiency. Now, this syndrome usually happens, or it's characterized by uncontrolled sensation in the leg, and you often relieve yourself by moving your leg a little bit. So you might find someone who is maybe moving their legs uncontrollably. This is because of iron deficiency most of the time. Now, another one is called intolerance. Now, this deficiency can affect the ability of your body to regulate the temperature, leading to an increased sensitivity to cold temperatures and sometimes hot temperatures. Cravings. We have ladies, especially when they become pregnant, they start craving for non-food material, and even food materials. So one of the causes might be iron deficiency. We have pale skin, like we saw earlier. We have shortness of breath. We have headache and dizziness. We have cold hands and feet because, like we said, it plays a very important role when it comes to temperature regulation. We have brittle nails and difficulty when it comes to concentrating. And also irritability. You have an increased susceptibility to infections, and you have rapid or irregular heartbeats because it's trying to compensate for the little capacity you have for carrying oxygen. So the little that you have, your body will try to hasten the movement of your blood to try to supply as much of that oxygen as possible. Treatment of iron deficiencies involve addressing the underlying cause and replenishing the iron stores. Now, we have several strategies. The first one is through diet. In case your body can be able to absorb ions from food, make it in diet. So we have several things which can supply this. We have red meat, we have poultry, we have fish, we have legumes, and we have fortified cereals. Leafy green vegetables also will help, and we have nuts. Now, if you're not getting enough iron, your doctor or your health care provider might provide you with supplements of ions because they also work the same way. They give you either through injections or maybe something that you need to swallow. And some of them can even be gotten over the counter. But you have to be very careful when you're dealing with iron. You'll have to take this according to the instructions that you have been given. Taking more of these iron supplements might lead to other complications. So it's very important for you to consult before you start taking them. Now, we have vitamin C, which is very important when it comes to absorption. Consumption of food rich in vitamin C, like citrus fruits, we have strawberries, we have bell peppers. They can enhance the absorption of this from the stomach. So if you have issues with their vitamin C, you are also going to have issues with their iron absorption. So you'll have to make sure that you balance them. Now, another way which is very important when it comes to checking whether you have that iron deficiency is being checked by a health consultant. You go to a hospital, they take blood, and then they check whether you have issues with your iron. This is a very good step. So in case maybe you feel you're not good, or you feel some of the symptoms which I've mentioned above, go to a hospital and get a test. There's several tests, like we have full hemogram, which I mentioned in another video. You can go and check it out. Now, blood will be taken, a smear will be made. That smear is your blood will be put in a glass slide, and then that glass slide will be put under a microscope, and then they're going to observe the shape and several other parameters of your red blood cells to determine the issue you have with your red blood cells and the quality of the red blood cells that you have. This is another way you can be able to check whether you have issues with your iron in the body. Now, sometimes you might get intravenous iron therapy. This is in case your anemia is so severe. So what they end up doing is we have blood donation. So someone will give you blood so that you'll be able to boost the number of red blood cells you have in your body and also improve the HB. So the carrying capacity of oxygen will be improved by you getting that intravenous delivery of blood from someone else. Now, when it comes to blood groups and how you do blood transfusion, I have a video on that. You can also check, just go behind and you just see a video on them. Just go see how transfusion is usually done. Now, treating an underlying condition which is causing this iron deficiency, like for example, you have gastrointestinal bleeding, which is leading to you losing your blood into the gastrointestinal tract. So if you have this, you'll have first of all to fix this, because if you continue, for example, you're taking supplements, but you're still having this condition, this thing will never resolve. It's actually going to get worse. So first of all, treat the underlying condition. We have regular monitoring, like we saw earlier. It's good to just go have regular follow-up in case you have or you have had an issue with iron deficiency. It's very good for you to get regular screening. You just go to a hospital, get blood taken out, and then a screening is done so that in case you have an issue with your blood, they can fix that in good time before your HB falls below a certain range where you'll have to get a transfusion, and then you start exposing yourself to the risks of transfusion. Now, it's very important to note that self-diagnosis and treatment without proper medical guidance can lead to other complications. So always make sure that when you're doing this, there is a healthcare provider who is well qualified enough to take care of this. So if you suspect that you have iron deficiency, go see a doctor. Now, iron deficiency is a manageable condition. It can be managed if you catch this early. Now, when you catch this early, you can get supplements and other things that will help in boosting your blood or the production of your red blood cells. Or maybe if the case was maybe you had an impairment when it comes to vitamin C, that is fixed. You get your iron, red blood cells back to normal, everything will be fixed. But if you catch this late, you'll have to have something like a blood transfusion that, like I said, it will expose you to other conditions, other risks which are associated with the blood transfusion. Now, if you watched this video up to this point, it means that you like what you're doing here. Give us a thumbs up, subscribe to the channel. And in case you have something, maybe we can continue this conversation down in the comment region. And as usual, let's see you in the next video.